I'm Stefan Walters. I'm an integrative therapist, and amongst all of the modalities that I use when doing work with my clients, I always have an attachment-focused base. I do a lot of relational work, thinking about the attachments that we have in our lives, working to heal some of the attachment injuries or traumas that we may have experienced, and to de-escalate dysfunctional attachment patterns, and then to replace them with positive and healthy attachment cycles, and to really promote those in our lives. I think at the moment, through the pandemic, a lot of us are feeling a sense of attachment injury. You know, the fact that we have been so isolated and cut off from so many of our relationships is an attachment rupture, the huge amount of attachment trauma. For us to be so isolated from our friends, from our families, from our colleagues, from all of our familiar settings and routines is a huge amount of trauma. So there's a sense of collective trauma, and I think increasingly I've seen that there's a real benefit to doing this attachment-focused work, to making sense of all this stuff that is being activated at the moment. And people are finding that it's not just affecting them individually, but also playing out in their relationships. That as there are these external stressors from the pandemic, this is playing out in relationships as well. So having a safe space in therapy to work through attachment patterns, to understand attachment dynamics, that when we feel insecure, we become hypervigilant, we get into pursue and withdraw patterns, we get into dysfunctional cycles. That's all normalized and destigmatized, and we work to de-escalate those cycles that can be so provocative and so damaging, and then to promote more healthy cycles. And we do that healing work to make sense of all this attachment trauma, whether it's from the past that's reactivated at the moment or through this pandemic that we're all going through.